Hello and welcome to Hornbill TV's News Pulse. I'm Akivito. Affordable health tech solutions could potentially address the unmet needs of about 65% of populations which is deprived of adequate primary health care. Innovations that can work in low-resource settings at health centers in rural and semi-urban locations across the nations are potential game changers. One such innovation, known as Qtrack, which is operated through a mobile and web-based application developed by Cure.ai with support from India Health Fund, was launched on January 18th at Mon District Hospital through the initiative of Mon District Administration. Qtrack is an end-to-end patient management software that includes a chest X-ray interpretation artificial intelligence tool named QXR. QXR is trained on one of the largest training data sets and can identify 30 abnormalities. It can detect findings suggestive of tuberculosis and aid several TB screening programs across the world. In a facility where radiologists are not available, the Qtrack platform augments or helps the doctor in screening and interpretation of X-ray findings to diagnose TB cases in sputum and CB0 negative patients but have signs and symptoms of TB. To get more detail on this, we have Dr. Tinenlo, who is a district TB officer of Mon District, on the line. Hi, sir.
Hello. Hi.
Thank you so much for joining us on this platform, sir. So, first of all, we just came to know of this wonderful initiative that has just been launched in Mon, which is the Qtrack. So, sir, could you please tell me a little bit about this application?
Sure. Like you said, this Qtrack has been launched here on 18th through the initiative of Qtrack and the district administration. So we have already started uploading these X-rays to this Qtrack, and then the Qtrack artificial intelligence.
Yes.
Through the artificial intelligence, they are interpreting the X-ray reading and giving it to feedback to us. So, in cases where we are not finding sputum positive and CB0 positive, when we upload the X-ray, if the X-ray finding is when they give back the X-ray finding, we take that finding and give the treatment to the patients. So basically, it's a artificial intelligence, like I said. Through this Qtrack, we are able to diagnose sputum negative and CB0 negative TB patients.
All right, sir. The other question that I wanted to ask you is, how did this initiative take place? How did Qtrack actually get in touch with the Mon District Administration, and how was the process of getting together, and now that it is applicable in the Mon District? So how did this all come about?
Initially, it was one of the programs launched by our Honorable Prime Minister, the Startup India. Through the Startup India, they developed this app, and through this Startup India, they started this application in Nagaland. Through the district administration, through our DC sir, we could come in contact with the Qtrack, and likewise we could start here in Mon.
All right, sir. So, Hornbill TV was getting a few reports stating that there are very less doctors and that healthcare facilities need to be updated in the Mon District. Well, now with the introduction of this app Qtrack, so do you think that there's going to be relief for the healthcare providers that are already in Mon?
Basically, this is just an augmentation of what we are having here in Mon, especially in the field of tuberculosis program. This Qtrack, it's just a screening tool It's not a confirmatory diagnostic tool for TB, but then it's just a screening tool which augments and helps us to interpret the X-ray findings so that in places where radiologists are not available, it is helping us immensely.
All right. All right, sir. So would you be kind enough to explain as to how the Qtrack app works? Say I'm someone in Mon, and then now I would like to use the Qtrack app. So how would I go about it?
We have this application which we can download from the Play Store.
All right.
But then the handlers will provide us the login credentials.
All right.
And when we take the X-ray, analog X-ray, and get the picture of the analog X-ray and upload in the app,
yes,
the AI will give the interpretation of the X-ray reading.
All right.
So it's a kind of X-ray radiologist. It's like a radiologist giving the feedback of the X-ray reading to us.
All right, doctor. Thank you so much for sharing with us the application and the usefulness of the Qtrack app, and we hope that this app will slightly lower your burdens while providing healthcare facilities. Thank you so much, doctor.
Thank you so much for having me. Thank you.
All right. So that was Dr. Tinenlo, who had just explained about the Qtrack app and what it does. So basically, it uploads a picture of the X-ray, and then the X-ray, through artificial intelligence, the artificial intelligence tells you what effect you have, and this has to do basically with tuberculosis.